Well, good afternoon. I'm Jonathan Shen, and I'd like to welcome all of you on behalf of the Cardiac Center and Joe Rosano for our Cardiac Center Town Hall to help clarify questions and maybe give you some information about the impact of COVID-19 as it has related to the Cardiac Center. And with that, I guess I'll ask for the slides to be advanced.
Great. Thanks again, everybody, for joining. I'm Joe Rosano, and we're really happy to be able to connect with you all today. This has been a trying time for everybody and with a lot of challenges, but especially for families that have a child with a chronic illness like heart disease. And we want you to know that we are here to support you during this time, and that our top priorities are the safety and well-being of your child. We did want to cover a few topics today, but first I want to just cover some key points about coronavirus and what this means for children with heart disease. Fortunately, COVID-19 affects children much less than adults, both in terms of absolute numbers as well as the severity of disease. And children with underlying heart disease do not appear to be at an increased risk for acquiring COVID-19 compared to other children. Now, we are certainly learning more and more about this virus every day and the manifestations that it can have, including the effects that it can have on the heart in some people. Matt Elias and others will talk about this, but you may have certainly heard in the media or reports about COVID-19 affecting the heart and affecting the heart in children. Fortunately, this, while it does happen and can be a severe problem, does appear to be uncommon and reversible in the majority of patients. It is also very important that children continue to receive appropriate medical care during this time. One of the things that we have seen when we look across the country is that many people have had morbidities or even have died from potentially preventable problems that they did not seek care for, in part hesitance of seeking care during this time. We have seen that vaccination rates among children have gone down pretty significantly, and these are of concern. We will talk to you about what we have done here at CHOP to make sure that it is a safe place for your child to receive care, but it is certainly important that appropriate medical care continues to be provided. Because of this situation that we're in, our practices have changed significantly to be able to accommodate our patients in a safe manner, and we'll talk to you about our inpatient and outpatient care and the changes that we have made and the safeguards that we have put in. And lastly, I do want to reiterate that our team here at CHOP is here for you. Again, our top priority is the health and safety and well-being of your child, and for any questions or concerns, we are here to answer them and to help you and your family get through this pandemic. And just a brief agenda, and then I'll turn it over to Dr. O'Callaghan. For our time here today, we'll give you an update on infection prevention and control, and Dr. O'Callaghan will provide that. Dr. Elias will give you some updates on our outpatient practice and our testing. Dr. Roan will talk to you about our inpatient care and the changes that we've made in our procedural scheduling. Sherry Kubis will talk to you about some other changes you will see as you get care here in the hospital. And Gino Palazzini will talk to you about our family services and resources that we have. And then we definitely want to leave enough time at the end to answer any questions. I do, before I turn this over to Dr. O'Callaghan, just a few housekeeping items. Please use the chat room feature if you have questions, and we will try to get to as many of those as we can. For any questions that we're not able to answer during the time that we have here, we will answer those and post those on our website. And certainly if you have specific questions about the health and well-being of your child, please reach out to your cardiologist and your care team. And with that, I will turn it over to Dr. O'Callaghan, who will give you an update on infection prevention and control.
Great. Thank you, Dr. Rosano. My name is Kevin O'Callaghan. I'm from the Department of Infection Prevention and Control. Apologies, we were just getting a little bit of feedback there. So my name is Dr. Kevin O'Callaghan. I'm from the Department of Infection Prevention and Control. We are the department at CHOP who are housed in our quality and safety divisions, and we are responsible for monitoring all kinds of community and healthcare associated infections, not just COVID, but obviously in this era of the pandemic, that is the bulk of our work at the moment, and we are spending pretty much all of our time monitoring the situation and providing guidance to all of the divisions and centers throughout the hospital on the state of the pandemic. So for the purposes of our discussion today, I just wanted to give a quick overview of what the COVID-19 pandemic looks like right now in the United States. There's about just over 5 million cases have been identified of this disease worldwide, starting back in late December when it started in China through to today. And of those, about 1.5 million are here in the United States. As we all know, the United States really has been an epicenter for this pandemic in the past month to 6 weeks, and we've really been responding to this here in the United States and locally for about the past 11 weeks. Here in Pennsylvania, as you might imagine, most of the cases that have been identified have been found in urban and suburban areas. So as you see on this map of Pennsylvania, the area to the southeast of the state around Philadelphia really is where we're seeing the bulk of cases. I know that map tends to look a little scary and shows a lot of cases. I think one of the reassuring things is that at this point in time, throughout most of the United States, what we're seeing is that although there have been a large number of cases over the past few months, in most places, the number of cases day by day is declining. And this graph shows the what we call the epicurve, or the epidemiology curve, showing the number of cases identified in a region. And the top purple line shows that back in late March, early April, we really saw a very high peak in the southeastern region of Pennsylvania, so around the city of Philadelphia. But we are now seeing those number of cases decline. And we also see that is true throughout the surrounding areas, and that includes both northern and southern New Jersey, in the New York City metropolitan area, and in Delaware and elsewhere in Pennsylvania. So what are we doing here at CHOP from an infection prevention perspective to prevent this infection here in the hospital and in our health network and to keep everyone safe? So I just thought I would review some of the measures that have been put in place with guidance from the Infection Prevention Control Department throughout the hospital, but which obviously also impact patients who are seeking care in the cardiac center. One of the big first ones is universal masking. So this is something that a lot of healthcare systems have done, but whenever you come to the hospital or to an outpatient visit here at CHOP, going forward, you will notice that all of our staff, both clinical and non-clinical, will be wearing masks throughout their work here at CHOP. Masks are very useful in helping us prevent the transmission of disease. They are primarily used to prevent transmission from a person who might be infected. So knowing that some people have very subtle or no symptoms with their coronavirus infection, where those people wearing a mask helps dramatically reduce their risk of passing on the infection to others. So having all of our staff and our caregivers who come here to the hospital be masked really helps reduce the risk of transmission here in the healthcare setting. One of the other things we're doing is pretty broad-based testing for COVID. So SARS-CoV-2, or the virus which causes the COVID-19 infection, is a virus that can be detected on a lab-based test that involves a nose swab. And many of you may have already experienced this in your care here at CHOP. We were actually one of the first places in our region to develop this test in-house. And we've been offering this test since early in the pandemic. We've done over about 10,000 tests here in our in-house lab at CHOP, which is actually a very high number. So we would consider ourselves a leader in this area. We offer this test for a broad variety of reasons, both for people who are having symptoms where we suspect they might have the infection, but also to help us screen people who have been exposed, who are coming to us from regions where they're seeing more disease, and to help us plan for admissions and for any testing or procedures. So we are now doing all of these tests every time somebody gets admitted to the hospital and any time that they are getting a procedure that might involve intubation, sedation, or anything that would involve slightly higher risk to staff or other patients. One of the other things that we're doing is making sure that we have enough personal protective equipment for our staff. So we put a lot of work into making sure that we are using all of the avenues of providing and finding personal protective equipment, or PPE, that our staff can use, and making the right choices around what PPE our staff use. So you may notice that different staff will wear different personal protective equipment, or PPE, depending on the type of care that they're providing. For a child that is in the intensive care unit, for example, who is on a ventilator, you may see staff using a lot more eye protection or N95 type masks for those higher risk settings. That may also apply in settings where you are getting sedation. So, for example, for an outpatient radiology procedure. For your regular office visits, what you might notice is that staff will be wearing their universal mask, but if they're doing an exam of your child's mouth or nose, they may wear eye protection, just in case your child coughs. And we are working very hard to make sure that we have all of the correct types of personal protective equipment available for all of our staff to do their jobs safely and to protect both them and the other patients they are seeing. And then the last thing that we're doing, that's sort of a big arm of our work, is working with our data analysis team. So we have a large in-house group of data analysts who are able to take information and data streams, both from what we have available here in the hospital, but also from other institutions, and turn this data into something that we can use to help us predict what might happen in the coming weeks and months and help us respond more quickly. So one of our big pieces of work is that we actually have been tracking and continue to track the number of cases that are happening of COVID-19 throughout our region and ultimately throughout the nation on a county level. We are tracking this day by day and are able to see those epi curves again on a county level and sort of show where patients are coming to us from, if those regions have higher than the background level of COVID-19, and if we might want to take extra precautions. So if you've come to us from an area in northern New Jersey or around the New York City area, potentially from other parts of New Jersey, you may have noticed that there was different responses because of the region you came from, and that our staff were using extra levels of PPE. Our analysis of this will continue over the coming months. We are aware that there is the potential for a second wave of disease as states and locales open up, and we are ready to sort of detect that and respond to it as necessary. So those are the big streams that we are doing in infection prevention, and so I'll leave it there and pass it over to Dr. Elias.
Well, thank you very much, everyone, for attending this event. I know this is a very difficult and unusual time, and we definitely want to answer any questions you may have. My name is Matt Elias, and I'm a pediatric cardiologist here at CHOP. I primarily see patients in the outpatient setting, and I'm sure I'm going to look at the attendee list, but I'm sure I know many people on the list here today, so I hope you're all doing well. So I'd like to talk for the next few minutes about outpatient visits and testing updates. Go to the next slide, please. As you know, our cardiac center sees a lot of patients, and through 2009 through 2019, you can see that our patients and our patient volume have grown every year. In blue are our new patients, in red are our established patients, and in this past year, over 35,000 patients we have seen in clinic across the Pennsylvania and New Jersey and our main hospital in Philadelphia. Let me go next slide, please. Of course, this pandemic has affected that outpatient volume. As many of you know, initially when this started in our region and really affected our lives on a day-to-day basis, we had to postpone many non-urgent clinic visits, which had to be quite stressful on your end and everywhere else. And at the time, our providers, myself included, were carefully reviewing all of our patients' records to determine who could be safely postponed at the time, whether it was 2 days, 2 weeks, or months. And now, as time has passed, weeks and now a few months later, we're focusing on ramping up and doing so safely. And so some patients may be seen via telemedicine and some via in-person visits. Medicine we'll talk about, as many of you probably have already experienced, is almost like a video conference, a FaceTime almost. And it's quite helpful. Again, we're looking to see which patients would be best suited for telemedicine to do so safely from home versus coming to our hospital or outpatient clinics. We know that families understandably may be concerned about visiting the hospital, visiting our outpatient clinics, and that's understandable. It's a stressful time to pick up milk from a grocery store, let alone come to a hospital or outpatient clinic and be around many people. And we do fear, as Dr. Rosano mentioned, that our new patients with potential heart disease or known patients with heart disease may be less likely to seek care. We want to reassure you that we want to encourage ongoing care, and that we'll continue to provide all the care that you are used to. The next slide. Telemedicine has certainly picked up in the past couple months, and telemedicine are the video conference technology where we can conduct visits safely. My chair here often, and I connect with you in your home and your specific cardiologist you'd be talking with. And here are a couple different pictures. You typically connect on a smartphone or an iPad, and there's different options for different technologies, but this is the MyChop app. You would download the MyChop app, log into your appointments, and with a click or two of the button, all of a sudden your cardiologist is there, and on half the screen with this cartoon there, and the other half is you and your child, and anyone else who might be in the room. And we can add interpreters to the visit. We can add, if you're used to see a fellow cardiologist, a nurse practitioner, when we can have multiple providers on one call. And next slide. On March 16th, when all of our lives really changed in this area, when our telemedicine visits were essentially zero, they've gone up every day, as you can see on this graph. And when I put this together last week, we were at 937 visits, and we are far past that now, over 1,000. And there are a lot of benefits to telemedicine. So one, it's very nice and comforting to on my side, to see my families face to face and to talk about their heart disease or for the new patient's potential heart disease, but also to see how everyone is doing with this pandemic. And you're able to do so safely from home. It's certainly more efficient, where you don't have to navigate traffic or waiting rooms, and when the visit is over, you're already home, which is certainly a benefit for you. And we can do many things. So we can talk about symptoms, we can conduct a telemedicine examination, and while we cannot listen to your child, we can do a lot of the normal things that we otherwise would do. So often with our exams, we're looking to see how fast your child's breathing, and if they have a work of breathing, if they are blue at all. We can do a lot of that just through the video screen. We can often review our last imaging studies together, and I've often turned around, pressed a button so I can show my computer to those who I'm talking with, and I can show you your last echo and point out different things on the screen. And from there, we can determine what testing is needed and the safest way to do so. And next slide. Some testing we can arrange quite easily. So if someone needs a Holter monitor or any rhythm monitor, we can put that in the mail and it arrives safely at your house days later or a little bit later. And for EKGs, echocardiograms, some tests along those lines, they're obviously harder to do and not currently able to do through telemedicine. But we have many different options. So we are establishing testing-only visits, not just at the main hospital in Philadelphia, but at many of our satellite clinics as well. And I included this information because for those of you who are only seen, for instance, in Philadelphia at our main hospital, but may live closer to another destination. If you live in Bucks County, but you normally see your cardiologist in Philadelphia, we can certainly work with you to arrange an echo and an EKG at Chalfont, where you would come in, probably have some vital signs, have an EKG if that was ordered, and also the echocardiogram, head on home, and then we arrange your cardiologist to call you and talk about everything safely. Next slide. And as we've already heard and will continue to hear through this hour, there are a lot of different changes that you will see, and I'll skip through some of them because we've already talked about them as far as universal masking. But before outpatient visits, you will be contacted as far as exposure, travel history. We have visitor restrictions where we're not allowing siblings into clinic for everyone's safety, but we are allowing 2 healthy parents who are symptom-free. The rooms are being cleaned. The employees are following a very strict sick policy. Obviously, we have lots of PPE for staff, and there's a wide array of different PPE that people may be wearing. And we're really trying to limit the amount of time in waiting rooms. So you might be waiting in a car when feasible. Probably not 90 degrees in August, but earlier waiting in a car or coming into a satellite clinic. Or may check in and go right to an examination room. And most recently, at the main hospital, we've been working on, instead of seeing your cardiologist and going back to the waiting room and waiting for your echocardiogram, maybe an exercise stress test, instead, the echo tech, the sonographer, would come to your examination room, pick you up and take you right over to the echo lab, and then bring you right back to the examination room, skip over the waiting room and all the other people who may be there. And next slide. So I want to pivot real quickly before passing it on to our next presenter, as far as just addressing a couple questions, and we'll certainly come back to this at the end of the talk today. But the biggest question that I'm sure you all had, and one of the biggest questions I had when this all came about in early 2020, are children with heart disease at higher risk for COVID-19 infection and really severe disease and poor outcomes? And a lot of this information, these questions, came from the fact that heart disease has been reported as a known risk factor for severe infections with COVID-19 in adults. It seems to be that is mainly coronary artery disease, hypertension, diabetes, obesity, and so far there's no clear evidence to suggest that children with congenital heart disease or other kinds of heart disease are at increased risk with COVID-19. That being said, we know, and we know that you know, that our patients and many of your children can become quite sick when contracting other common respiratory viruses, and depends on the kind of heart disease, but that's even more reason why we're taking every strategy possible to protect our patients and their families. Fortunately for all of us, serious disease in children with COVID-19 has been very rare, despite any underlying issues, heart disease included. Recently, as Dr. Rosano mentioned, there's been a lot of news coverage, understandably, about Kawasaki disease and COVID-19. And to give a background, this information came out, now it's almost a month ago, from the UK with the National Health Society and the Pediatric Intensive Care Society, reporting, unfortunately, often otherwise healthy children or older children, adolescents, who are presenting critically ill to intensive care units. Fortunately, doing well in the long run, but presenting quite sick. And this information was put forth by the New York Times, Washington Post, and it's since gone on and on. And we are spending a tremendous amount of effort at CHOP and working with other institutions, and I know others are doing the same across the world, look into this. And the CDC provided a health advisory now a week ago, sort of providing more information about this for the United States. Next slide. There have been many different names for this condition that you probably have read about: pediatric multisystem inflammatory syndrome, and a combination of those different words. CDC has put forth a name that we've gone with, the multisystem inflammatory syndrome in children, or MIS-C, associated with COVID-19. Now, this is a recently described syndrome in children, and it presents with a severe inflammatory symptoms. And the reason why Kawasaki disease has been brought up, because there have been similar clinical and laboratory features to Kawasaki disease. But in the end, it's very possible this will be a distinct entity from Kawasaki disease. Yet we can use a lot of our known treatments that work quite well with Kawasaki disease for this condition. There's also evidence of an association of this syndrome with a prior infection with the SARS-CoV-2 virus that causes COVID-19. It does not necessarily seem to be an active infection, but probably an infection a few weeks ago, but we're still learning more. Unfortunately, despite all the information that is out there about this condition and all the effort we're putting forth here at CHOP and elsewhere to look into this, learn more about it, and help our patients, it's still extremely uncommon. And compared to the number of patients with COVID-19, including children, the vast majority do very well. And this is still much less common than the typical causes of fevers, of childhood illnesses. And lastly, there's been no evidence to suggest that there's an increased risk of developing this syndrome in patients with other medical issues. Specifically, no increased risk if you've had prior Kawasaki disease or in patients with congenital or acquired heart disease. So I will stop there. We can certainly come back during the Q&A to answer more questions. And I will turn it over now to Dr. Rome to talk about inpatient procedures. Thank you.
Thank you, Matt. Hello, everyone. My name is Jack Rome. I'm a cardiologist here at CHOP, and I specialize more in inpatient types of procedures, particularly cardiac catheterization. And I'm here to talk to you about what the impact of this epidemic has been on the hospital-based procedures and how things have moved since then and what we can expect going forward. So as you've heard already from Kevin and Matt, and know yourselves very well, this has been an unprecedented event that's changed all of our lives in serious ways. But the thing that I've been most impressed with personally is the incredible response of the people in the hospital. Kevin works with the infection control group, and they have been at the forefront of really managing this to make the hospital a very safe place to be for everybody who comes here, patients, families, and the staff. But just to sort of walk through where we've been and where we're going, our initial response to the crisis when it unfolded in the end of March was to follow the guidance from the state and the hospital, and basically all of our non-urgent procedures were canceled. The purpose of this directive was to make sure that patients who were coming into the hospital were safe. And as I'm sure you all remember, at that time, there was a huge concern about even the availability of masks and what everybody calls PPE now, which is a term that none of us had ever knew about before, but now it's second nature to all of us to hear that word, that expression, I think. And also, in order to, since we didn't know where this was going, the idea was to have as much availability in the hospital as possible in the event that we were facing a true crisis like occurred in New York, but fortunately did not reach those proportions here in Philadelphia. So that was what happened initially. And as you see on this slide, as a consequence of that, our procedures went down. So the red are the number of catheterizations that we typically do on a monthly basis over time, and the blue are the surgical procedures, and the lines are the average month to month. And you can see that in March and April, the number of heart caths that we performed dropped down virtually, pretty much in half. Although interestingly, the surgical volume did not really drop as much as you would have thought, and that's because it just so happened that at that time there were a lot of newborns and other children who had needed urgent surgical procedures. And so this makes the point that we never really stopped doing what we needed to do to take care of our patients. And with the help of all those people that I talked about, have been able to do it very safely. But nonetheless, the result of this on the next slide has been that there were a number of people who had their procedures canceled, or I should say delayed. And so what has happened since that initial directive was we rapidly started looking, as Matt sort of alluded to, talked about for outpatient visits. We looked at all of the children who had to have their procedures delayed as inpatients, and to make sure that it was safe to delay them and to be clear on amongst ourselves about how long they could safely be put off. So medical teams reviewed everyone who had procedures that were either postponed or in whom the procedure never had gotten scheduled because of this disruption, to determine exactly when they needed to have those procedures done so they would not suffer any ill consequences. Every single doctor had the final say on their own patients so that they could weigh in and make sure that they, being the ones who knew their patients the best, could direct when those procedures needed to take place. And then we've tried very hard to make sure that every family knows where they are in this whole process for their children. As I said before, and I showed you on the last slide, throughout the epidemic, procedures have been continuously and safely performed. And under the guidance of the infection control team, the hospital and cardiac center staff have put into place a whole host of processes to be sure that children are safely cared for. You've heard about many of those, and Sherry, who will speak after me, will tell you a little bit more about some of the specific things that are going on in the cardiac center that you might expect to see. Next slide, please. So what can we anticipate going forward? Over the last weeks, we've been carefully increasing the number of our inpatient procedural volume. And although things may look a little bit different around the place, as there are fewer chairs in the waiting rooms, masks are the new fashion accessory that everybody's wearing, everything's really going very, very well. We have everything we need. We have plenty of staff. We have plenty of protective equipment and supplies. Well, we have almost everything. We still don't have enough parking. We haven't solved that nut, cracked that nut. But most importantly, our infection control processes are robust and they really, really work. So one of the things I want to be sure everybody understands is that you should feel very safe coming here. I personally believe this is the safest place you can be in this epidemic. But we have a backlog of patients waiting for procedures. And while we can promise that no child's health will be compromised by this backlog, we may not be able to get everybody's procedure done exactly when they had wanted. As you may know, summer is a challenging time for us, even under normal circumstances, because kids are out of school and families really like to have their school life not be disrupted and get procedures done during the summer. We'll do everything we can to accommodate everyone, but it may not be perfect. Next slide, please. Can I have the next slide? It's not. Hello? Sorry. There's a little glitch here, I think. So in closing, I just wanted to let you know that if you have questions, the most important thing is to contact us. Please call your cardiologist if you have concerns about upcoming procedures, either because you haven't heard or because you're worried about coming in for one. You can also speak to the scheduling center directly, and the number is listed here, and I think you'll see it again later. And I've even left my own office number too, if you want to contact me. Thank you very much. And I'd like to introduce now Sherry Kubis, our Director of Cardiac Center Nursing, who's going to tell you a lot more about what it's like in the hospital and in the clinic.
Thanks, Dr. Rome. My name is Sherry Kubis. I'm Director for Cardiac Nursing here on the inpatient side, and so I've been part of working with all of the teams to make sure that everything is established and implemented in a way that provides safe care for all the patients, for the families who are visiting, and also for our staff to keep them healthy. As we know, it is adults who are most likely to catch this and to transmit it, so that's an important part. If you could move to the next slide for me. First, I really want to just put a big thanks out there and take a moment to recognize all the members of our cardiac community. You know, everyone has really come together to help navigate, what we're going through overall as a team, and that's what we're doing here in the hospital. That's what we're doing out at our offices, and that's how we're taking care of each other. Also in the public and the community. And I know that you guys have really supported each other, so thank you for that. We know that our nursing, our medical, and our support staffs have really risen to the occasion, despite some of the really scary parts in the very beginning and nervousness. As you can see, things did not really change here much in the hospital for the cardiac center particularly, and they were quite busy really working with very sick kids and supporting their families through it, and sort of like going through the motions at the same time of wondering what was safe for them, for their own families. So big shout out to them. And then to our families, our patients, our donors, you guys have continued to be our inspiration and our motivation. You are why we do what we do, why everyone comes to work every day and puts their whole heart into what they do. So thank you for all of your support. You can see some great food donations that were sent here to the teams in the hospital. If we move on here, so I wanted to kind of give you some ideas of things that, to give you a forewarning of things that would look different when you come to CHOP, whether it's here at the main campus on the hospital, or whether it's in your clinic visit. We've talked a lot about the universal masking. You're going to see that all staff are wearing masks all the time. And I think that that's an important piece also to just remind your children as you're preparing for visits. And sort of that's why we wanted to put some pictures out here so that they're sort of prepared for a different encounter or different experience when they do come in. Of note here as well, masks are also required for patients and families. That is both at the outpatient area and the inpatient areas, and I'll talk about that a little bit more here in a second. You'll also see that we've made a lot of changes to the layouts of the rooms in different scenarios. So often that's meant just removing furniture or putting up different barriers and different guards. But you'll see that there's things that we've put into place because we know that in clinical settings, you can't always maintain 6 feet social distancing. And therefore, we needed other avenues to really create a layer of protection. The mask and preventing me from coughing on someone or coughing onto a counter. Also setting up distance so you didn't naturally follow human behavior and sit close to someone, or putting up these guards when we knew that you'd be forced to be in close contact with someone. Other things that you'll see, so we do have semi-private rooms, particularly in our step-down unit, the cardiac care unit, or CCU. While we still are very full and we do have to use both rooms at times, we have increased the criteria for which types of patients can be in there, who's allowed to use the bathroom, or if the bathrooms are not allowed to be used between separate families. So there's a little bit of different execution on how we use those rooms moving forward to ensure that we're maximizing and mitigating all risk factors to those patients. We also have additional cleaning of all areas, public spaces, clinical spaces, that happens in a way, thankfully this is not such a hardy disease and is quickly and easily cleaned, but it does require cleaning between sessions. So we've put in processes in place for that. There are also a number of public spaces that used to be common space where multiple families or multiple patients could use that no longer are allowable for multiple people in one area, such as the playroom and the teen room. The other big piece that is different is we now also do daily symptom checks for every parent who is visiting and in-house, and this is really screening if you have fever, if you have new GI or respiratory symptoms, because there are very strict limitations for any adult to be inside any of our buildings with these symptoms, and that also applies to all of our staff as well. If we move to the next slide, I put a couple of pictures up here just to kind of give you a quick idea. You'll see that the waiting rooms are sort of more empty as we have fewer chairs in them, and they're spread out in different sections. You'll often find throughout the hospital that there will be stickers and signs on the floor of where you can stand in line instead of getting too close to the person in front of you. There's guidance to stay far apart. There are areas, particularly in the cafeteria, the emergency room entrance, of one-way traffic only, similar to you would see in your grocery store. You can see here a picture of our teen room that is no longer functional and only available for staff to enter, get the materials, bring them to the patient rooms. And in the top right, you can see one of the plexiglass shields that's there between where the parent might stand to sign some paperwork and then interact with the patient care representative. And if we go on to the next slide, in addition to physical things that we've put into place, the biggest part is really partnering. And this is where we're coming together and working as a community to minimize risk, because we can clean as much as we want, we can try to put up different pieces, but it really has a lot to do with how we all behave as adults, staff and parents. So we really ask that all of our parents who are visiting, whether outpatient or inpatient, are practicing good hand hygiene, using good respiratory etiquette, and then using that social distancing. And this is also important not just while you're in the office or you're in the hospital, but while you're at home. If your child is admitted and you go home to go to the grocery store, we're really encouraging and educating our families to understand what's important and how they should interact, because that is the risk is actually higher when they're out in the community versus when they're here in the hospital. We do have a very strict visitor limitation policy now, a little bit stricter than even our typical flu season one. So we do not allow any visitors outside of the parents or the direct caregivers identified for the patient when admitted inpatient. We also are no longer allowing any siblings unless it's a breastfeeding sibling who is staying with that mother at that time. And then we're strongly encouraging only one parent stay with children who are admitted overnight, and really trying to minimize the traffic back and forth, as we know that it's the back and forth that might cause someone who does not have an exposure today but might get it in the future. All parents and patients are wearing masks as well. It's particularly to patients who are 2 and older, and if you're able to do it, I know that there's, I saw a couple questions in the chat box already. We know that some of our patients are already naturally low saturated, and wearing the mask all of the time might be difficult for them in breathing. Some patients who developmentally perhaps have autism, or just it wouldn't be safe for them, or they wouldn't be able to maintain the mask on. There are some certain exclusions, and we'll talk about those with your children if that's appropriate for them. Obviously, they're sick and in the hospital, they wouldn't be wearing a mask while they're in their room, but if they were getting up and walking out in public hallways, that's when the patients would wear their masks. And then the other piece is really just encouraging families to let us know if they're not feeling well. This is really important. We cannot have sick parents at the bedside here in the hospital, as that does pose a very significant risk to the children admitted. But we have a ton of resources in place where we can support those families and find the right support for the patients who's admitted, and then making sure those families get the care they need in a way to get them healthy and back to visiting. A couple of other clinical changes that you'll notice here at CHOP. So many of our staff who, if they're not absolutely needed in-house, they're now working remotely and working from home, and that is the goal, to have fewer humans in the building, less risk of transmission. Additionally, from a clinical perspective, we have actively reduced the number of providers that will come in contact with each child, whether that's in a clinic or whether that's inpatient as well, just so that only the people who need to go in and do an exam are the ones going in, to limit, again, that excess exposure to people. We do have 2 separate COVID-specific units, so you have no concern. There would not be active COVID-positive patients interacting with our ICU and CCU patients. They're actually locked units with very strict and discrete protocols for which staff are there and how they're managing them from an isolation perspective. We have all kinds of policies and procedures and processes in place for if there was a cardiac patient who needed care and was COVID positive, how we would manage them safely and separate from other patients in the units. And we do have processes in place, really that look at procedures and appointments and prioritizing those based on urgency that Dr. Rome really talked about, so that we were bringing in the patients who needed us most while we're trying to really maximize our space at the same time. And now for all patients who are currently admitted, we do have a new implemented 48-hour post-discharge check-in call, just to make sure that the families are understanding all of the discharge education and everything is going through, because we know that life is much different right now than what it was in January, February, and many things that we could do easily may be a little bit more challenging as many stores and things are closed. So we're following up with our families after discharge to make sure there were no challenges or barriers that they ran into. And last couple of pieces here. Every patient who's coming to CHOP does get a pre-screen. So before your appointment, you'll be getting a call a couple of days before where they're going to be asking questions specifically about any symptoms for both the caregivers who will be coming or the caregivers living with the patient and the patient themselves. They may ask questions about where you've been living and where you're from, if that is indicative of an area that is currently active as a high rate of transmission, and how that might imply risk factors of being exposed at home. And then with that information, we thoughtfully make a plan for every visit. What's the best way and safest way to make that happen? And finally, our last piece is on testing. So all patients who are admitted to the hospital are tested for the COVID-19 virus. And this allows us to make sure that we are placing patients in the right units and the right pieces. So even if you have no symptoms and there's no concern, if you're having any type of procedure or being admitted, we'll test for the COVID-19 virus. If you're already admitted and your child has been here for 5 days but now needs to have another procedure on day 8, because it is a new procedure that will induce a particular type of procedure that can be high risk to the staff, we will retest again for COVID-19 because we know that we're not perfect and there could still be potential for transmission at that point in time. And all parents or family members in certain circumstances, if they start to have symptoms or have concerns, we do have processes in place to test them in order to really ensure confidence that it's okay for them to continue staying with their child inpatient. If the patient or a family member has been exposed to someone with known COVID-19 disease or lives in a really high rate of transmission area, then we will enact certain procedures where we do have isolation precautions established at that point in time in case development of the COVID-19 were to happen. It's sort of a reverse protection modality that we have, and then after a certain number of days where that risk of developing COVID-19 has expired, the isolation precautions come off. But you may be asked to wear the precautions for a day or two because the test is being sent, or because you're coming from an area where there was a known exposure and we want to be on the extra precautious side. Here you can see an example of, if you go back one quick second, the team at the bottom is the drive-up testing team. So if your patient is scheduled for, a cath, next week, or a procedure that they would need to have pre-testing done, that's an example of the team who would be doing the COVID-19 test at the drive-up testing center. And the picture to your right is one of those tests being done on a patient there. So with that, I'll quickly turn it over to Gino, who is one of our social work who works here with us on the inpatient side to talk about some family resources.
Thank you, Sherry. Good afternoon. As Sherry said, my name is Gino. I am a social worker here at the Cardiac Center. I'm just going to talk quickly about family services and resources we have going on at CHOP. The services that we have going on in-house right now, the primary services that are in-house are social work. We are on a skeleton staff right now, but we definitely have 3 social workers in-house, and then the remaining social workers are working remotely, but you can always contact them as you normally would through their phone, email, MyChop, or even have the bedside nurse page us. Child life and specialists and child activity coordinators are on site. You can contact them through your nurses or cardiology child life at email.chop.edu. Creative art therapists, the music therapists, and the art therapists are on site as well, working with our families and our patients during this time as well. And if you'd like your patient or your child to get connected with them, you can speak with their child life specialist. Working remotely right now, we have psychology services. They are gearing up to come back in-house, so we'll be happy to have them back. And the chaplaincy program started coming back this week with time-limited services on site. The next slide are some educational and resources for the families. The first one is a fun craft for kids that you can definitely do at home. The second bullet point is a CHOP site that has honest and simple educational resources for children and talking points with them. The next 3 are books, both in English and Spanish, that you can read together with your child for them to have a better understanding of the COVID-19 pandemic. CNN put together a very good town hall for kids with Sesame Street, and it really talks a lot about tackling educational services, anxiety that the child might be facing, screen time issues, and then also how to kind of have play dates, how to deal with play dates. And the last bullet is the CHOP coronavirus update. It is how to navigate COVID-19 during your visit here at CHOP. Planning your next visit, CHOP committee is definitely committed to your safety while you are visiting us. Talking points with your children, once again, a lot of coping skills are listed there for yourself and the child, and a lot of other additional resources and information for the family. Here in Philadelphia, we are lucky enough to have the Greater Philadelphia Coronavirus Helpline. I might be out of... We'll go for this one first. Sorry. Additional COVID-19 related efforts for family are available. A lot of our families, unfortunately, are facing financial loss, difficulties paying bills, or food insecurity. If any of these issues are facing your family at this time, certainly feel free to reach out to the social worker. There are a lot of different state and local resources that we have access to make sure that you are taking care of yourself and your family during this time. The next slide is our wonderful social work team here at CHOP. Melissa and I cover the CICU. Therese covers transplant and heart failure. Damaris is in the CCU. Lucia covers the STU, the families that are expecting, and the fetal heart program. Outpatient is Ashley, and then single ventricle and cardiac kids is overseen by Lynn. So with that, I will be passing it over to Joe and John, I believe, for question and answer.
Great, thank you, Gino. Maybe I'll jump right in here. We have quite a few questions, as you note, in the chat box over there. And just as a preview, we are going to post the recording of this webinar here on our website. And then at that time, we'll also post answers to the questions that we are not able to get through here. We did select a few that were kind of common themed questions that were submitted in advance, and Joe and I are going to kind of tag team these. The first one, which was probably most appropriate for Matt Elias, it says, I know you spoke to this in your presentation. We were wondering if you could expand more, as we've heard, is my congenital heart disease child considered high risk or a vulnerable population, because their pediatrician won't say yes or no?
Well, thank you, and this is an excellent question. It can be hard to answer. And before, when I included everyone with congenital heart disease altogether, and obviously every one of your children, every child is different from another child, and risk factors probably do differ altogether. There's no clear evidence, fortunately, that severe outcomes and poor prognoses and likelihood of COVID-19 infection go up with congenital heart disease altogether. but there is theoretically a short difference between someone who has mild valve disease or had surgery as a newborn and has been fine and now is being seen every year, every 3 years, versus someone who has a single ventricle and has baseline oxygen saturations in the 80s. And fortunately, despite the theoretical increased risk in certain populations, we do have knowledge of many patients across the world who have had COVID-19 in very intense areas, New York, Europe, and elsewhere. And congenital heart disease, even those who your cardiologist and you have always talked about as higher risk, are not coming forward as those being infected and being hospitalized.
Thanks, Matt. And maybe a follow-up question to that. We've had a number of inquiries about recommendations for restrictions, and one parent asked, are there additional restrictions we should follow for our cardiac child as states start to open up again, such as letting them play outside with other children if they are wearing masks?
So this answer may certainly vary provider to provider and in time. Probably my answer a week ago would be different than my answer a week from now because there's so much more information changing on a day-to-day basis. The first thing I would recommend to everyone, and certainly what we're doing in my own family, is to make sure you're following the most recent recommendations for your state and even for your county. You know, in Pennsylvania, there's a variety of different colors. I believe it's green, yellow, and red. And here in Philadelphia, we're in this red category of stay at home. And making sure that you are staying at home. And even without congenital heart disease, just limiting the likelihood of transmission and to decrease the spread of COVID-19. But when things do go to yellow or green, or if you're in a different state and it's different, I wouldn't necessarily say that in general you have to treat your child with congenital heart disease differently than others. But if at baseline you were considering them and your cardiologist were considering them higher risk just for contracting a common cold, then I would err on the side of being a little bit more conservative. And this is often a case-by-case situation. You can certainly talk with your individual cardiologist too about your son or daughter's situation.
Great. This would be a good question. I don't know if Dr. Callahan's still on the line, but just his video off. But any of our esteemed experts there. Oh, yes, great. The question is, as a parent of a congenital heart disease child, are there additional risks to my child if I work in a high-risk industry, for example, dental office or healthcare setting? In which case, should I not return to work when they open up?
That's a great question. I think first and foremost, I think this is that sort of assessment of risk is a very personal decision, and certainly it's not going to be one size fits all. Everyone is a little bit different. I think things that are reassuring. So number one is that we know from data, for example, from Philadelphia Department of Public Health, that the rates of COVID disease in healthcare workers in our region are actually lower than in the general population. And it's probably reflective of a number of things, but one of the big ones is that, I think we are lucky and fortunate in our local region that the peak of the pandemic for us was not as high as it was in other places like in the New York City metropolitan area. And that we have, globally speaking, across most healthcare institutions, a pretty robust supply of personal protective equipment. So I think for any parent who works in a healthcare setting and is contemplating returning to work, I think that decision should be made by asking yourself a few questions. So do you feel, has your office or your healthcare facility provided you with information around what your responsibilities will be at work? What kind of patients will you be taking care of? What are the PPE practices and PPE availability? I think for the most part, for most people, if there are, pretty good answers to those questions, like, there's a plan for you to have personal protective equipment available to you, you have a good sense of the patients that you will be taking care of, there's really no reason to not go to work and take care of those patients with some reasonable personal precautions that you can take, such as being sure that you yourself are being diligent by using your personal protective equipment, performing really good hand hygiene, particularly when you're returning home from work. And then I think the last thing would be to make sure that you communicate with your cardiology team around the nature of your work, the nature of the patients that you're taking care of, and very much in particular, if an incident happens where there is a what we call a PPE failure, where you were exposed to a patient who's subsequently found out to have coronavirus, where you were not wearing all of the PPE recommended. And your employer will work with you to identify if that has happened and what your risk was.
And another question for the group. In the event that my child seems unwell, not related to COVID, what is the recommendation for seeking care to avoid exposure risk from a doctor's office or an emergency waiting room?
I can answer this. If that were to be the situation, please call us. If it is a cardiology issue, or primary care doctor if it's not. I second what I believe it was Dr. Rome who said that when I'm at CHOP and our satellite clinics, I feel extremely safe, and probably more so than just in the general population when if I'm ever out. But we are taking all the different safety precautions. So if your child has a heart issue and has a flare of that heart issue, or you have any concerns, what you would normally do, give us a call, send a MyChop message, whatever you normally do, and we can figure out the safest way to see you, whether it's telemedicine or, in that case, probably in person.
Great, thanks, Matt. And I know Jamie Fitzgerald has been going through all the questions that have been coming through on the chat area. We probably have time for a few more questions. Jamie, are there ones that are good themes that would be good for us to touch on and answer?
Absolutely. Thanks, Dr. Arzano. The first question coming through is for Dr. O'Callaghan. Are we recommending antibody testing for kids, and is it available at CHOP?
Sorry. We'll feedback again. See if we're in the same conference room. So that's another great question. I think there's a few layers to that. So I think first off, I would say the PCR no swab test that we do looks directly for the presence of the actual virus. It's a very reliable test for that. It's very sensitive, meaning it picks up pretty much all of the cases where the virus is present. It actually probably picks them up a little too much, because it can still pick up dead virus that has been hanging out for a week or two, or potentially longer after your infection has passed. The antibody tests, on the other hand, look in your blood for evidence that your immune system has responded to coronavirus or to viruses like it. There's a few problems with that. One is that immune response doesn't show up immediately. So if you do the test while you're infected, it may not be positive. It can cross-react, or that means it can sort of inappropriately pick up a prior infection with a different type of coronavirus. So it could tell you that you're positive for antibodies, but they're actually to another routine seasonal coronavirus. And then the last thing is, we don't know yet that those antibodies tell us that you're at a point in your infection where you will be able to fight off the virus again, or that you in fact have already killed off the virus. So there's a lot of unknowns about antibody testing. So our recommendation would be, we would not use them to help make the diagnosis, and that's in line with CDC recommendations. If we're trying to make a diagnosis of coronavirus infection right now, we should be using the nasal swab. And we wouldn't rely on them to say that you are now safe from infection, because of the issues with cross-reaction, and also because of the issue of not knowing when in the infection that the antibodies become present. So for now, while these tests are available pretty broadly, we're not routinely offering them here at CHOP as part of our diagnostic testing process for coronavirus. And we would recommend against using them to help make decisions about whether or not you've had infection or you're safe from infection.
Thanks so much, Dr. O'Callaghan. Our next question, I'm going to send to Dr. Elias. Can you give some guidance on return to school and resuming of normal activities? Is it safe, and are there specific safety precautions that children with heart disease should take when they do return?
Like everyone else, this is another excellent question, and an equally very difficult question, one that everyone with children is thinking about right now. Certainly in March, when school was closing for a few weeks, that we thought weeks. And now all of a sudden it's May, almost June, and we're thinking about the fall. And we're seeing news about universities and different things that they're doing for older children. So again, much will probably change. And see what happens in your state and county and even individual school district. And I know every school district, mine included, is looking into different and other different things to help keep our children safe. But if schools are open and taking the necessary precautions, whether it's person, maybe combination of distance learning, depending on the age, and overall with congenital heart disease as of now not showing higher risk for COVID-19 infection, serious outcomes, then you can follow along with the rest of the population, other children. But again, if your child seems to be in the more higher risk, you have very frequent visits with your cardiologist, you can certainly talk with your cardiologist too about individual cases and your patients and your children.
Thanks so much. Can you speak a little bit about return to college as well?
So if elementary school and junior high and high school is difficult, the college maybe a little bit more so. Though from what I've gathered, there's pros and cons. So with a lot of universities and students living on campus, social distancing sounds like it would be very hard. But the pro is that distance learning is I imagine would be much easier with a 20-year-old than a 5-year-old. And there will probably be a combination of the two. Every school is going to be a little bit different as far as universities at that level, and probably going down for younger children as well.
Great.
Thanks so much.
So, sorry, Jamie, do you want to do one more question?
Yeah, we have one more for you. So we have a number of questions about prolonged mask wearing for patients with chronically low oxygen saturations. Is it safe?
From my standpoint, the biggest thing about wearing masks are that it's not necessarily that comfortable, and you have to become used to it as an adult, and all of us, Dr. Callahan there right now, wearing a mask. But when you're an adult and it's uncomfortable, older 3-year-old, if they will keep a mask on, that's even harder. But for lower oxygen levels, certainly the masks that are made for this reason, and even a lot of at-home masks that we're all wearing or buying, should not necessarily decrease oxygen level. That has not been a concern that I've encountered.
Great. Well, I would like to thank all of our speakers for joining. And most importantly, I would like to thank all of our families for joining us this afternoon. I hope this was helpful. You can see some important numbers and resources, and we will post these on our website and have answers to all of your questions. Again, please reach out to your cardiologist if you have any specific questions or concerns about your own child. And we want to, again, reiterate that we are here with you as always, and we will get through this together. So with that, I will end this session, and thank you again to everybody.